I'm first going to come in the room and perform hand hygiene, and I'm going to provide privacy with my curtain here. My name is Caroline. I'm going to be your student nurse today. If you could tell me your name and date of birth.
Caroline Jones, 7/11/91.
Okay, and today we're going to be giving you a sub-Q and an IM injection. If you could stand up for me, I'm going to show you the injection sites for sub-Q. First, you can use the lateral part of the arm, the fatty portion, the lateral portion of the upper thigh, that's fatty, 2 inches away from the belly button right here in the abdomen. You can use the upper back, the fatty portion here, or the upper hip that has fat. And with a sub-Q injection, you would use a 25 to 27 gauge needle, and the inch of the needle would be 1/2 to 5/8 inches. You would use a 1 to 3 milliliter syringe, and you would give a 45 or 90 degree injection. With your IM injection, you can use your deltoid muscle right here, which you would take, you'd find the bone right here and form a V, and you would do the injection between the V. You could do the vastus lateralis, which you would find the midline of the thigh and the side of the thigh right here. You would put your arm here on the upper thigh and right above the knee, and anywhere between here you can inject. If you could lift up your knee for me. For the dorsogluteal or the ventrogluteal, you would find the greater trochanter here, and you would put the palm of your hand, the bottom part here, and you would go up to your iliac crest, and then you would put your ventral gluteal here, and your dorsal gluteal would be more back here. And with your IM injection, you would use a 20 to 23 gauge needle, and the inch would be 1 to 1.5 inch needle, and you would use a 1 to 3 milliliter syringe, and you would inject at 90 degrees. So, you can sit down. I'm going to put on my gloves again, and we're going to be giving you an IM injection first. So I'm going to use an alcohol swab to wipe off the top, and I'm going to there's actually already fluid in this one, so I'm going to take it out. The first what you would do is you would draw up 30 milliliters of air, and you would insert it in the vial here, and you would push in the 30 milliliters of air. Then you would pull it up, and you would draw back your 1 milliliter. And then if you had any air bubbles or anything, you could flick those out. And what you would do is you would wipe down the area of the skin with the alcohol pad, and you would inject the IM at 90 degrees, and you would use a dart-like motion, and you would insert slowly in, and then when you get done, you pull it out, and you would discard this in the hazard container. And then the next thing you would be your sub-Q injection. With this, you would have a smaller needle, of course, and we're going to use the fatty part of the arm here. So I'm just going to use air. I'm going to pull back the 30 milliliters or the amount, and you would stick it in at either 45 or 90 degrees, and I'm going to do 90. So I'd stick it in again like a dart-like motion, push in the air slowly. You would pull it out and apply pressure. And if you needed to, you would use a Band-Aid for if it was bleeding, and you would also discard this in the biohazard container. And I would take off my gloves and perform hand hygiene, and then that's it.